So our next panel is on power for health and gender equity. Our moderator is Dr. Lily Bowie. I'm going to have everybody come on up as I introduce Dr. Bowie. Dr. Bowie brings deep expertise at the intersection of climate resilience, disaster preparedness, and equitable community recovery. In her role at Southern California Grantmakers, she leads regional efforts to advance climate justice and strengthen disaster resilience through cross-sectoral partnerships, research, and policy. Her work spans academia, media, philanthropy across the Pacific and Caribbean, making her uniquely suited to guide today's conversation. Please welcome Dr. Bowie in our panel.
Good morning, everyone. Thank you so much for being here. It's my honor to open up our first panel on power for health and gender equity. And I'm really glad this video was shared because it highlights something at this intersection that we're going to be getting more deeply into. And I'm going to offer some opening framing thoughts before we actually jump in. And just to kind of set the tone for this conversation and why this intersection is so important. We know that globally the burden of energy poverty is disproportionately carried by women. And this is seen not only in the context that we just saw in the video, midwives working in the dark in remote areas, but also the respiratory health of women working over open flames. And so access to power is not just life-changing, it's life-saving, potentially. And so if it's all right, I'm gonna ask permission to embarrass our panelists briefly by introducing them to you. Starting to the farthest on my right and your left, we have Sharon Allen, who's the co-founder and CEO of the World Telehealth Initiative. Sharon is local, by the way. And as a recognized leader in international philanthropic telehealth, Sharon seeks to improve the lives of vulnerable populations through collaborations that address global health equity. The United Nations Association also awarded Sharon with the Peace Prize in 2023. She serves on the World Health Organization Digital Health and Board of Advisors and roster of experts. Next, we have Sara Rossi, who's the Managing Director of the Health Resiliency Fund at Direct Relief, also local. Sara is a mission-driven, results-oriented strategist with over 15 years of experience in public health, healthcare finance, and international development. She leads philanthropic grant-making for global health infrastructure strengthening, ensuring health centers and hospitals are equipped to respond when disasters strike. She's also spent a lot of time advising several ministries of health in sub-Saharan Africa and the Asia-Pacific region. And then last but not least, we have Anna Colby, who is manager at Schneider Electric. She's based in DC and is joining us today from the East Coast. She's currently an access to energy manager at Schneider Electric and brings experience from previous roles at US Trade and Development Agency, the America Society Council of the Americas and Eurasia Group, and holds a master's degree in Latin American Studies at Georgetown University. So our first question for the panel, what's one example from your work where you can say that access to reliable power has meaningfully improved health outcomes or advanced gender equity? Maybe Sharon, we can start with you.
Sure. So World Telehealth Initiative connects volunteer medical experts with clinicians in very low-resourced clinics and hospitals globally. And so we can't do that unless there is power. An example I have is Janet, who lives in remote Kenya. She had just delivered baby Serafina, and hours later, she developed a crushing pain in her chest and she was struggling to breathe. And the clinicians on site at St. Clair's Hospital gave her medication and they were trying to make her comfortable, but they knew something was wrong, something they weren't prepared to deal with. They did not have a backup physician to call, and they saw Janet's life slipping away. Through telehealth, they were able to connect with an emergency medicine physician in Washington State who then beamed in to collaborate with that local clinician. And Dr. Borak in Washington suggested a further test, which revealed a blood clot in Janet's lungs. She received appropriate treatment and was then able to go home with baby Serafina. That's one example of many, many things we hear every day.
Maybe Sara?
Sure. So at Direct Relief, we believe that healthcare is a human right and that power is a prerequisite for health. So over the past 8 years, since 2018, we've invested over $60 million across 25 countries to equip our healthcare provider partners with resilient power solutions like solar microgrids, and we're just getting started. When I started preparing for this panel, I thought, okay, my program is called Power for Health. I'll talk about health, and I'll let the other panelists talk about gender equity. Day to day, I tend to work with solar installers, solar developers, facility managers for healthcare facilities, OEMs, and those fields can be pretty male-dominated. But then I took a second to start thinking deeper about how my work intersects with gender equity, and it didn't take me long to come up with quite a long list of projects that we have funded that directly positively impact women and girls by expanding access to resilient power in healthcare or protecting it. So I think it's important to also think about not just the patients that are benefiting by creating conditions for safe, comfortable, dignified care, but also for providers who have told us time and time again across disparate settings how being able to rely on having electricity there whenever they need it and when they're providing that care, it brings them peace of mind, it brings them back some time in their day, and it brings them pride. And it allows them to focus their energy on what they do best, which is providing care, and what they do best. So if you'll bear with me, I actually have a handful of examples. And I wanted to note that we're on our all-female panel for gender equity. So first, just this past week, we commissioned, we work with a breast cancer care center in Mexico City called FUCAM, and we just equipped one of their mobile units, think like a Sprinter van, with solar and battery, and they provide mammograms out in the community to detect breast cancer early and connect those women to care. So not only is that extending access to that critical life-saving service to women who otherwise wouldn't be able to make it to the clinic to get timely care, but also we've heard like big thumbs up from both the providers who run the mobile clinic and the communities where they park the van that they've broken up with the diesel generator, both from like the pollution and inhaling it in the lungs and from the noise. We have another mobile example. In January, I was on the Big Island of Hawaii, and we were with Healthy Mothers, Healthy Babies, and we have funded them to expand their mobile fleet and solarize them. And they can do everything on those vans from ultrasound and fetal monitoring to telehealth to vaccination. And I think that's an example of where, there is reliable power in the health facilities typically, but extending access to those most remote and hard to reach places. We also work in conflict zones, war zones. We're not afraid to fund our healthcare partners and provide them with medicines in places like Yemen, where we are working with Med Global to equip 2 comprehensive emergency obstetric and newborn care hospitals with solar microgrids. And in Ukraine, where we purchased more than 2,000 Tesla Powerwalls, and those went on critical public infrastructure across the country in a context where their grid is being targeted. And so they need that resilience in order to keep the lights on in operating rooms, maternity wards, and to keep the heat on because they have really long, harsh winters. And lastly, I just wanted to feature a project that we're working on with Schneider Electric in India with the Self-Employed Women's Association, or SEWA, which is a trade union representing over 2 million informal sector female workers. And we're going to start a pilot where we're solarizing 5 of their community learning centers in Gujarat, where today the high is 106 degrees Fahrenheit. And these women work in just these brutal environmental conditions, and they have these trusted multi-purpose women's spaces that they can go, these community centers. And we're soon going to be able to provide them with the air conditioning and the power so that they can get fresh water, they can refresh themselves, they can access medicine because it also doubles as a medical access point. So yeah, we're really excited about that, and we have a lot more to do.
Yeah, Anna, maybe you can tell us more about the collaboration and everything else you're working on as well.
Yeah, no, absolutely. And we're so happy to be here. First of all, thank you to Megan and Unite to Light for inviting me here to beautiful Santa Barbara. I'm so excited to be here with you all today. And And yeah, our partnership with Direct Relief, I think, is a really great example of how in collaboration, in partnership, we can just do more and do it better. So Direct Relief for Schneider Electric, which is a more than 100-year-old company that specializes in energy technology, we really see a massive value in working with partners like Direct Relief, where they have just this massive global footprint of hospitals that they're partnering with around the world. And they have that specialization in partnering on the ground and delivering what is needed to these clinics and health facilities around the world. And what Schneider Electric can bring to the table is our specialization in energy technology. So really, we can bring the solar expertise and all of the partners that execute sustainable, reliable, affordable projects that can be operated and maintained over the long run. So really working together, we're able to collaborate and drive more impact. And just to give one more example, actually now tying back to Sharon's comments, I'm going to take us back to rural Kenya, to the villages of Matongo and Nyagoto, where Schneider Electric partnered with a solar installer, PowerPoint Systems, to bring 2 solar solutions to these rural clinics to bring 24/7 reliable power. And before this intervention, we saw a lot of challenges at the clinics. Firstly, as was just discussed in the UNFPA project in Bangladesh, women birthing at night did not have light. And then there was also unreliable access to critical vaccines and medicines as well. And really, we were able to, by bringing that 24/7 power, mitigate all these challenges, and the results were quite staggering, actually. We saw a decrease in 83% in maternal deaths and 70% in decrease in infant mortalities. We also saw a 4-fold increase in visits to both of these clinics. So I really think that the key message here is that energy is not just infrastructure, it's a life-saving care, especially for women and children.
Absolutely. And Anna, I wonder if we can stay with you a little bit, because our next question I think you could speak to. So building on what you just said, what approaches or models are you seeing prove most effective in driving outcomes at scale?
Yeah, absolutely. I think scale is critical here, and Megan alluded to this earlier, that really, we've already made so much progress, but how do we not only scale installation of solar systems, but how do we make sure that those systems last for their entire lifetime, right? So really, I think that there's 2 critical things here. One is bold partnerships, like what I was just mentioning, Schneider and Direct Relief, and also having a full ecosystem approach. So not just looking at an initial installation and then our work is done, but looking at the life of these projects over the long run. And I have a really great example I'm excited to share today, which is a project in India, an initiative called Energy for Health by Selco Foundation. So this is an initiative to electrify 25,000 rural health clinics in India by the end of this year. So this has been going on for I think about at least 5 years now, and they're very close to achieving this 25,000 number. So it's very, very impressive to achieve this type of scale, and I think it's worthwhile to look at some of the lessons learned from this project and where those success factors have been. So the first one is that there was a very strong partnership with the governments, both the Federal Ministry of Health of India and all of the state-level governments' ministries of health. So there was a full buy-in from the governments, both on the policy side, as we were discussing earlier in the previous keynote, as well as some co-funding opportunities as well with the government. Then Selco Foundation was able to bring in other blended finance in addition to government finance. Governments oftentimes, they can't do this alone, so we need to bring in that additional capital. So they brought in IKEA Foundation and some other CSR partners to really support funding for this. And because they had this ambitious 25,000 number, they were also able to tap into the carbon markets, right? Because they really had that scale to make a tangible difference with carbon credits as well. And then thirdly, they were looking at this from a full ecosystem approach. So beyond just a CapEx installation, they were able to look at, okay, how do we make sure these solutions are operated and maintained in the long run? So one of the ways they're doing this is through remote monitoring. This is something Schneider Electric, as an energy technology company, really believes in. So we see that they're monitoring all 20,000 plus clinics today on a remote monitoring platform, making sure they're all operating. So this is critical. The other way is making sure that we have well-trained people who can install these solutions and maintain them over time, even in the rural and remote areas. Oftentimes, most of these technicians and electricians live in the major cities. They don't always want to do a 15-hour trip to do a quick fix on a solar energy solution, right? So this is something Schneider Electric has been supporting. We have an ecosystem of Schneider Electric trained electricians and technicians, and we target some of the more rural regions of India so that there are people in place, partners, that are willing to go out and do these installations, do quality installations, and maintain them over time. So really, I think just to wrap this up, it's really key that the technology is already here now. I think 16 years ago, we were talking a lot about technology. The technology is there, it's available, and it's more affordable than ever. But what we're still lacking is, first of all, working even more closely together to scale the impact, and also working with a full ecosystem approach, where we look at the life cycle of the project over time.
Thank you so much for that reminder. I think many of us in this room have heard this before, but it's always worth repeating that if you want to go faster, you go alone. If you want to go further, you go together, right? So this importance of ecosystem level partnerships for systems change is always going to be important. And thank you for emphasizing that. And so Sarah, I want to go to you. I wonder if you could talk to this element of how we reach people and have a deeper impact. Because despite all this progress, people are still getting left behind. We're still seeing gaps in numbers of people being reached, as we heard, despite all these goals towards making sure that people have access to power. So what's preventing these solutions from reaching more?
I have my prepared answer, and then I'm going to give a new one that I just thought of, which when you said ecosystem of partners and buy-in from government, I think one big gap that I've been reckoning with, but I think I'm not the only one, is the past 15 months or so, the contraction of US federal government funding for these types of projects, both domestically and internationally. And although Direct Relief has never accepted government funding, we swim in these waters, and our whole sector has been deeply affected. And it weighs really heavily, and it's making us have to make really tough choices. But it's also forcing us, or allowing us, I think, to get really creative and really engage in new coalitions with other funders within philanthropy and other sectors, like private sector players. Because like you said, no individual can really solve any of these complex systems challenges on their own, no matter how big of a philanthropist you are. And Direct Relief is large, but it's not one of the largest. But we can do a lot more when we're all working together. And I know you have a lot of cool experience on that. If anyone wants to talk to Lily during the break from her position at SoCal Grantmakers in that space of alliances of aligned funders on topics of common interest. But I also think a gap and sometimes can also kind of related to cost is that permanent solar microgrids can be expensive. And so having a suite of technological solutions available depending on the needs of the partner, and being able to meet partners where they are, whether they just need something smaller and more portable, whether that's Luke Lights or other products from Unite to Light, or we work with Footprint Project in the US and internationally now as well to do sort of mobile and immediate post-disaster solar solutions. And then we have sort of more of our permanent 25-year lifespan systems as well. So we can try to help in some way to more partners, even with our fixed or whatever level of resources we can bring.
Thank you so much. And actually this question brings us to kind of turning towards the audience. Just a quick poll. I meant to do this at the beginning, but we know this is a mixed crowd. And so who here is a student? Okay, we got a couple. Who identifies as an academic or researcher? I'm a recovering one, so. Okay, perfect. And then any investors, philanthropy, stakeholders, people who work for foundations? Okay, we've got some representation. Who's in the private sector? Who's a business leader or considers himself one? Wonderful. Okay, so knowing that this is such a mixed crowd, we understand that part of this work is aligning on incentives and goals, right? And so I want to ask our panel, where can a group like this, from everyone's different corners, have the greatest impact? How do we start thinking about that? And what's most needed right now? Sharon, I want to start with you, and maybe Anna, you can kind of weigh in on this as well.
I would say one of the highest impact opportunities for this group is really to invest in the foundational infrastructure. And that then allows clinicians who are on the ground, motivated and prepared to deliver the care they need to do. And of course, reliable power is one of those infrastructure investments that could be made. And when combined with the medical education or telehealth or the various modalities, that then becomes transformational. So I'd encourage you to think holistically about how you approach these problems and how we approach these problems for, greater impact into the future.
Well, I love what Sharon said, because she have to start with the basics of having the reliable power there, right? We need to get everyone electrified. And that is, I think, the basis of all of the impacts we'll see from amazing things like telehealth and economic activity and all of the other amazing things that come with electrification. And to take it a step further, as she's saying, in terms of a holistic approach, I think, how do we make sure that these systems last over the long run? We need to invest in capacity building for both electricians, technicians, also for nurses and practitioners. So there's a lot of training that needs to be done and engagement on the ground with the local communities, the clinics, to make sure that the full value is being derived in the solar energy solution. If you just install a solar solution and you don't train someone on how to use it, how to operate it, how to maintain it, and how to derive value from it, then that solution might not be utilized in the ways that we expect, right? Also, as I mentioned before, sustainable long-term finance. So when you're looking at the overall project costs, let's not stop at just the installation costs. We need to see how could this be financed over the long run in terms of operation maintenance. That could be through carbon finance. That's carbon finance and distributed renewable energy credits are good mechanisms for this. It could be through bringing some value to the clinic, like productive use of energy, where they can maybe do some charging for the community there, and they can collect their own funds. But what we find is that no matter how great of an installation it is, the battery will need to be replaced in 5 to 7 years. So we need to think about when that battery needs to be replaced, we don't want to start from scratch again, right? And oftentimes we've seen when a project is very CapEx driven, you'll just see a whole new installation installed on top of the other solution 2 or 3 times, instead of just fixing the old one and replacing some of the basic components of that solution instead of replacing the entire thing. So I think that's really critical. And then the third one is we have to involve the local governments. And this is the challenging part on the policy topic, right? But in the end, most of these clinics that have the most need are public clinics, and we need to get the governments on board. We need the ownership and accountability of who owns these systems, who maintains them, and how is that going to last in the long run. So getting the governments involved from the beginning is also really critical.
And thank you for reminding me. I forgot to pull who is part of government in the room. Yes, I did not mean to intentionally leave you out because you're an essential part of the equation. So I want to invite our panel in our closing question to kind of just imagine ourselves 10 years from now. And in this visioning process, what do you hope we no longer will be talking about in this space? Like, if we have this same panel in 10 years, what will no longer be an issue? What will have been overcome at that point? Maybe we can start with Sara.
Sure. I think that 10 years from now, or I hope that we're not talking about solar microgrids for healthcare facilities as a nice to have, a luxury, optional. I think right now, in conversations that I have with leaders from healthcare facilities, they're often wondering, will this pencil? Like, what's my payback period? Like, what's the cost of investing in the system, even with philanthropic support? And I think that unfortunately, I think the warming world we're living in, climate-driven disasters becoming more frequent, intense, devastating consequences, that it's going to become less theoretical, the value of resilience and the cost of inaction, that's going to be much more deeply felt and personal to more decision makers and more healthcare facility owners. So I think that, by what would that be, 2036? I think that the movement, it's unstoppable. I think there's going to be that many more, a groundswell and that much more of a track record of how many facilities are already solarized, and hopefully it'll just be a given.
Sharon?
Sure. I would say I hope in 10 years that where a woman lives does not determine whether she survives childbirth or whether her children receive adequate medical care. And as Sara said, power shouldn't be viewed as a luxury any more than, a trained clinician and clean water at a healthcare facility. So I do think we will make, extravagant strides toward this, and that's the vision that I have for 10 years from now.
Yeah, really echoing the thoughts of Sara and Sharon. I think in 10 years from now, I hope we're not talking about this is a challenge, that clinics still lack reliable power around the world. I hope that this is something that is 24/7 sustainable, clean energy is embedded as part of all health clinic planning and financing, and considered a standard of care instead of a, as you well said, nice to have. And that we've really gotten past this stage of kind of piloting and ad hoc into building fully scaled sustainable systems, where the local capacity building and operation and maintenance is embedded into the projects and into these systems, and where things like technology and remote monitoring allow us to seamlessly operate these even in the remotest regions of the world.
Thank you for helping set that vision. We do have some time for Q&A. There is a mic out there somewhere. I see a question up front. If we don't have an extra mic, I will run this mic over here.
Well, thank you so much for the amazing work all of you are doing. David Hochschild with the California Energy Commission. Just a more personal question, if that's okay. Energy has been a very male-dominated space for a long time, and as women leaders in the space, I'm just curious if you could share. I have two daughters. My youngest is interested in getting into energy environment. Just were there any mentors or inspirations that helped you get to the leadership roles you're in now that were especially important in your life?
I can start. I do remember the first energy class I took at Georgetown University just over 10 years ago now, and it was led by two gentlemen from Latin America at the IDB. And they really just did such an amazing job breaking down the energy matrix, energy security and allowing us to profile each country that we wanted to deep dive into. I did Mexico. It was very interesting. And they were just amazing mentors and guides, and really sparked that in me, that interest of the intersection of energy and climate and sustainability.
I haven't been in energy for very long, just 2 years that I've been at Direct Relief. I'm a public health person by background, and so coming to Direct Relief allowed me to start my steep and exciting learning curve on clean energy. And I would like to give credit today to actually Megan, Bernie Reuter, and Emily Elzane, my direct report from Direct Relief, who we together sort of got to help come up with some of the aspects of today, and just having you both as thought partners, co-conspirators, fellow women in clean energy and global development here in Santa Barbara. We have quite a cohort here in Santa Barbara. I think we punch above our weight with that. Has really been exciting, and again, a testament. It's hey, we're all women working on this up here. That's cool.
And I would say my inspiration for global healthcare is largely from my co-founder, Dr. Yulin Wong, and not so much directly related to power, but he just views things that no problem is unsolvable. So even in a new nonprofit, 10 years ago, it's this is a roadblock. There are no roadblocks in his vision. And so that is really helpful to approach any problem, that know there's a solution. There's some really bright people in here that do that exact thing. So that's what I'm inspired by.
We might have time for one more question. I see one over there. Getting my exercise this morning.
Hi, Stephen Robertson with Alight, and this is for Anna. I have a question more on your work in India with the solar panel, like the 25,000 project. Could you share more about how you're working with utility companies? Because that was something you talked about, working with governments, but as you know, we're working in Somalia to build a large-scale settlement, and part of that is working with a water utility company to expand that. But any learnings on the utility companies in India?
That's a great question, and I love Alight and all the amazing work you do. So happy you're here. So, you know, from the Access to Energy program, I would say because distributed renewable energy has become relatively the most affordable and sustainable option out there for bringing energy access to kind of the most remote and rural, hardest to reach communities. We don't work as much with the energy utilities. We're working more with like small scale kind of installers, distributors, the local governments, and kind of at that intersection. But I would say that Schneider's core business is working with utilities every day. So I can get you some insights from them if it would be helpful. Yeah.
I was told we actually have time for one more question. So does anyone have a burning question they want to ask our panelists? I thought I saw a hand somewhere over here. No? Okay. I wonder if you have any closing thoughts now that you've heard from each other and had a sense of what people are curious about. Sorry to kind of throw this on you, but we do have a little bit of extra time. So Sharon, I saw your mic go up.
Oh, I was just going to say that these types of events where groups and organizations can come together and really bring this thought leadership together is extremely valuable. And just hearing from my fellow panelists and the incredible work they do. And again, you know, together, this is how we'll combat these challenges.
Thank you so much. I want to invite you in just really giving a round of applause to our very first pre-coffee panel. And thank you to these amazing women for lending their superpowers to this work. I encourage you to say hello and ask further questions as the event proceeds.